Welcome to the video. My name is Brent, and I've created this stroke prevention educational video to raise awareness on the dangers of a stroke, how to recognize a stroke, what to do when you do recognize a stroke, and how to reduce your risks of having one. Let's get started. So, what is a stroke? A stroke is defined by an interruption of the blood flow to the brain significant enough to cause a neurological deficit, meaning that this causes damage to the cells in the brain in the area with the reduced blood flow. Now there's two types of strokes. The ischemic stroke, which is caused by a blockage of blood flow, often a blood clot. This blockage in blood flow can also be caused by a piece of plaque that's broken off inside the arteries. The ischemic strokes are more common, most often around 80% of the strokes in the United States. The second type of stroke is the hemorrhagic stroke. This is caused from bleeding from the vessels in the brain, most commonly the arteries, which reduces the blood flow to the areas of the brain that are beyond those arteries. This is less common, often roughly about 20% in the United States. The hemorrhagic strokes often have a worse outcome than the ischemic strokes. Now you may be asking yourself, how serious can a stroke be? Strokes are actually very serious in nature, and if left untreated, can cause death. The good news, however, is most strokes are identified early, which leads to earlier treatment and better patient outcomes. Strokes are among the 5th common cause of death in the United States and the 3rd leading cause of death in Europe. Strokes are also serious enough that almost 1/4 of those that have a stroke often have a repeat stroke during their lifetime, most often within the first 5 years after their first stroke. Now, how do you know if you or someone you know may be having a stroke? Well, some of the signs and symptoms of a stroke is a sudden severe headache, changes in or loss of vision, which often is painless, numbness of the face, more commonly one-sided, numbness and weakness in the arms and legs, again, which may be one-sided, the inability to understand speech or not being able to speak themselves, a loss of balance, loss of consciousness, seizures, slurred speech, facial droop, coma, and death. This is important to remember. The more symptoms that are present, the higher the likelihood the person is having a stroke. If they're having 3 or more, the likelihood is about 80%. So, what do you do if you or someone you know may be having a stroke? Well, immediately call your emergency medical team. Immediately. Time is brain. This means that the more time that passes before you or the individual is treated, the worse the outcome will be. So now that you know the signs and symptoms of a stroke, the next question to ask is, what increases your risk of having one? Unfortunately, the answer to that question is a lot. A number of conditions can increase your risk of having a stroke. Some, however, can be managed to reduce your risk. Some, however, cannot. Some factors that cannot be changed is your age, your race, your gender, and your genetics, your family history essentially. Fortunately, there are more modifiable factors, which means factors that you can change, than there are non-modifiable factors. Now these include diet, high cholesterol, high blood pressure, smoking, obesity, alcohol consumption, stress, and inactivity. These are only a list of the common modifiable factors. You should check with your primary healthcare provider for more information. So maybe you're overweight and have high blood pressure. What can you do? Well, some things you can do yourself. Eat a healthy diet, exercise often, limit your alcohol intake, do not start smoking, or if you have, please stop immediately. Also, taking measures to reduce stress can be beneficial. If you have high blood pressure, high cholesterol, or diabetes, you are severely at risk for a stroke. Therefore, you should visit your primary healthcare provider for treatment and to stay on your prescribed medications. Research shows that you can significantly reduce your risk of a stroke by up to 80% while you are following these guidelines. Not only are you reducing your risk of a stroke by following these guidelines, you're also providing yourself with some benefit. Exercise is very beneficial for yourself. For those who are already fit, only 20 minutes a day of exercise 3 days a week is adequate enough to reduce risk for a stroke. For those who are unfit, 30 minutes a day, 5 days a week are a minimum for reducing your risk of a stroke. For those who have been diagnosed with the higher risk factors for a stroke, such as diabetes, high blood pressure, or high cholesterol, it's important for you to continue to see your primary healthcare provider. That way you can stay current on your medications and have control of your disease. Not doing so will increase your risk of atherosclerosis, which is plaque building up on the blood vessels inside of your body, which may weaken the walls of the blood vessels, increasing your risk of a blood clot or bleeding from a ruptured vessel, which is the cause of the stroke. So now that you know the importance of reducing your risk factor of a stroke and how dangerous a stroke can be, please educate and save lives. Thank you.